Good afternoon. So we're going to talk about supplements today. First off, who uses supplements in this room? All right, what are we using out there?
A probiotic.
Probiotic, okay. That's a good one. How about you, ma'am?
Just one a day.
One a day? Okay, multivitamin.
Vitamin D.
Vitamin D, we will cover vitamin D today. That's an important one. But the multivitamin is a good one too. B12, that's another good one. We will cover that one too. So let's go ahead and dive on in. So our first one we're going to talk about is ginkgo biloba. Was looked at several times for fatigue and cognitive function. What they found with it is that it will help you with fatigue, can make you feel a little better. However, it does cause drug interactions, especially with antidepressants, very commonly used medications in the world. Another thing, you have to use it for like 6 weeks before you see any change in your fatigue. As far as making you feel sharper, really hasn't been shown to do that. So usually pretty expensive to find, not a lot of great results with it. The next one is echinacea. Has everyone heard of echinacea before? Okay, we use it in the normal population. We recommend it a lot to help with colds, flu virus, kind of that whole flu season type thing. But the way it works is it revs up your immune system. When we look at MS, it's an overreaction of the immune system. So in a normal population, I say it's a safe medication. In the MS world, I say let's avoid it because we don't want to mess with the immune system any more than we already have that your body's already doing. So we want to avoid that. And that's what we see here. We can worsen the disease state because we're causing your immune system to rev up. That's already the problem. So also there's lots of drug interactions. That's the important thing to take away from this. If you remember nothing else from today's presentation, is that all these interact with medications. They interact with your different disease states going on. So don't ever take one without letting your doctor know, and your pharmacist, and any nurses you work with too. The next one I wanted to touch on quickly is St. John's wort. This is kind of like the worst offender for drug interactions of any supplement that we commonly see in the world. So St. John's wort is usually used for people that are feeling a little down. It's almost kind of like a mild antidepressant. However, it leaves the body through the liver. Pretty much every other medication we use leaves the body through the liver. So they all compete to go through this one organ, causes increased levels of a lot of them, thus leading to a lot of drug interactions. We list a few right here. Most of these are other psych medications, such as like benzodiazepines or like Xanax or diazepam. Antidepressants, you guys can probably name them all between everyone. And amphetamines are like Adderalls or even like the Provigils out there that sometimes help you stay a little more alert from the fatigue. So if you're not on any medication in the world, this isn't a bad supplement. Pretty safe if you're on nothing. As soon as you take any other medication, we want to go ahead and avoid this because of the drug interactions. Plus, we can get an antidepressant that's a whole lot cheaper and much more efficacious too. So that's kind of what I say on this one is, in this population, anyone that's on medicine, avoid it. If you're perfectly healthy and not on anything, okay, it might be okay. Cannabis, this is usually a hot topic anymore. So we can see, kind of looks like the wonder drug, right? Can cure anything, right? Just ask someone and they tell you it'll cure it, right? So there are some drug interactions. It kind of, it's a downer, so anything that can cause you to be a little more sleepy, like a lot of antidepressants kind of cause you to just be down, not quite as peppy as a lot of times. That's why we take a lot of them at bedtime. Also, anticoagulants, that's going to be a common theme too. That's our blood thinners. That's our warfarin. It also can be like our Plavix that a lot of people are on, aspirin regimens for your heart. So lots of drug interactions. Now, when we look at MS, we looked at two things. Well, I take that back. We looked at a lot of things, but the only thing we ever saw any improvement with is with spasticity. And we're going to break that down a little bit more. So there's a lot of scales that doctors and nurses use to judge your spasticity. We're not going to see any change on those. But patients will report that they feel better, have less spasticity symptoms. So it's one of those that on paper, no difference, but you feel better on it. Now we need to talk about the proper way, though, to ingest this. Everyone knows about the smoking way. First off, that hasn't been shown to help with any of this. It's also, marijuana has the same problems with lung cancer as tobacco. So we want to avoid that way just because we don't want to hurt our lungs trying to make ourselves feel better and cause lung cancer. They also talk about there's like sprays, there's all sorts of different ways, which you can kind of see here in the picture that it's available. However, the best way if you want to explore this option is through a prescription product actually out there called Marinol. It's been around for many years, and it can help you with the spasticity. It also helps with nausea associated with all sorts of medicine. It's been used a lot in the cancer world for years to help with nausea, vomiting associated with chemotherapy. It also has been used a lot to help with appetite stimulant. We've all heard of the munchies associated with that. So one of those things that you can talk to your doctor about, yes ma'am?
Would you say that name again?
Sure, it's Marinol, that's Marinol.
Thank you.
And the nice thing about it, since it is a prescription product, it is covered by a lot of insurances. It's the pure form of THC that's been quantified, so we know how much is in it. It comes in different dosage strengths. So we're getting the substance that we believe causes most of the benefit from marijuana into your body without all the other junk that kind of causes problems that we are associated with it. So, like I said, you can talk to your doctor. It's covered a lot on Medicare and different plans. So there is coverage. It always requires a prior authorization. Very, very rarely does it ever just go straight through. But, you know, if you meet certain criteria, you've tried other anti-nausea medicines, or you've tried other appetite stimulants and you're having trouble putting on weight, it is something you can explore with your doctor. There isn't necessarily a recommended dose. It comes in 2.5, 5, and 10 milligrams, and different people respond differently to it. So, not a clear-cut answer. Kind of depends on how much nausea you're having. They typically dose it based off nausea and weight gain. So, it kind of like you dose it to the effect. Okay, ginseng is another one that we've probably may have seen on the shelves at some point in time when you're looking around at the pharmacy. And it's been proposed to increase energy, but it's one of those that increases the energy by working through the immune system, so it interacts with anything that suppresses the immune system, which is what a lot of MS drugs do. So this is another one that in this particular disease state we want to go ahead and avoid because it can cause our immune system to react differently, which leads to flares and all sorts of adverse effects. Okay, now we're moving on to the ones that I personally find to be a little bit more beneficial. So the first one is coenzyme Q10, and anyone who's watched TV has probably heard of this or seen the new latest, greatest miracle form of it on there that you can get for $20 if you call this phone number. So the nitty-gritty of it, though, is that it really works well for cardiovascular health. And what happens is our cardiovascular system consists of our heart, which is a muscle, our arteries, which are blood vessels with muscles surrounding them, and then a lot of people take statin medications such as Crestor, Lipitor, Simvastatin that can cause that muscle pain. You probably have heard of somebody that has muscle pain from a statin medication. And that muscle pain is caused by the statins cause a depletion of this particular substance in our muscles. So there's a couple different ways we can look at this. If you're on those medicines, we want to replenish that and keep the levels high so your muscles don't have that pain. Or if you're not on it, you can talk to your doctor about it just for overall cardiovascular health. Now there is one important drug interaction, and that's with anything that's quote-unquote a blood thinner or anticoagulant, especially warfarin, also known as Coumadin. And it's one of those that if you're on that, it's not that we don't want you not to take it, but you need to talk to your Coumadin clinic so we can adjust and check your INRs accordingly. So it's very, very important to talk to your doctor about it. Another thing to look at is that there's lots of different companies that make it, and this is one of those that you kind of get what you pay for a lot of times. The lower quality, cheaper ones tend to not get into your body as well, and thus you don't seem to get as much effect. So if you just go to your general pharmacy, I usually recommend Nature's Made. It's the one that comes in the yellow bottles, and it has a little label on there that says it's USP tested, and that means they've actually taken their products and they test them at a laboratory for consistency of product. That's very important when we look at drug interactions because we want to make sure that we're giving you the same amount all the time, especially if you're on any anticoagulants. So we can adjust accordingly. Now there's lots of different dosages out there. You know, it comes as low as 50 as up to 400. And what I usually say is if you're on a statin, let's go for a higher dose because we're trying to rebuild up. So if you're on Lipitor, you're on Crestor, you're on simvastatin, let's go for a higher dose of coenzyme Q10 so that way we can re-put it back into your body. It's gone down. You can use a lower dose, which usually costs less, if you're not on those because we're just trying to maintain. So if we bring it down with statin, we want to bring it back up, takes more of it, versus we have plenty, we're just trying to maintain, we can use a lower dose. The next one I wanted to talk about is melatonin. Anyone in here ever used melatonin before for a sleep aid? You have? Okay. What do you guys think about it? Did it work? It worked? It does work. It's actually a very good medicine. A lot of doctors recommend it. Kind of the things to watch out for with it, though, and why you don't want to take it without a doctor recommending it, it can worsen depression. If you do have depression, it can make it worse. Another thing to watch out for is dosages. We usually say start with the 2 to 3 milligram and dose accordingly. If you're finding it's not working, go up a little bit. Some people get a lot of hangover effect from it, kind of like Benadryl, makes you real groggy in the morning. Go down in dose. Huge range out there. It's one of those, you can buy it from any company, it tends to work just as well. There's nothing special about buying a more expensive one. But talk to your doctor because of the interactions, we say, with antidepressants and benzodiazepines, because it makes depression worse, it makes you drowsy. They put in here immune suppressants, kind of, everything if you read on paper does. However, it's safe. Doctors are familiar with it. We know how to handle it. Definitely, if you're having trouble sleeping and you don't want to use prescription, you don't like the dry mouth that comes with like Benadryl or some of the Tylenol PM products out there, it's a good alternative. Just want to have that conversation. Cranberry. Has anyone used cranberry in here before? Okay. So it's available in lots and lots of different forms. There's the powders, there's the pills, there's the juices. The key is that choose whatever one you want to do, and if you do want to use the juices, don't get the cocktail. The cocktail is usually only like 5% juice. You aren't getting enough. You got to go for the kind of more bitter, pure cranberry juice. Costs a little bit more, but that's the only way you get enough of the substances found in there to help you prevent those urinary tract infections. And it doesn't treat a urinary tract infection. If you have symptoms of that, you need to see your doctor to get on the correct antibiotic before it becomes worse. But the way it helps you prevent them is that bacteria that cause urinary tract infections kind of grow these sticky things on the outside of them, and that's what sticks in there and causes you to get the infection. What this does is it kind of puts a coating over those sticky things so they can't adhere to the walls of your urinary tract, so you kind of then flush them out. The best treatment is plenty of fluids to keep flushing. The more you put things out, the less things tend to go up and cause infection. But the cranberry juice can help when you flush to make sure you really get those bacteria out. So I know it's hard to say, drink more water when you already have problems with incontinence and different things, but it truly, I promise you, is the best way to prevent an infection. Evening primrose oil. This was a new one to me, but when I got reading in the literature, I did see back in the 80s, they did do a lot of research with its effects in MS. A lot of big hopes, a lot of people were hoping it would kind of be the miracle supplement. They didn't really find it helped at all, and it does have a lot of interactions with anything that causes your blood to bleed easier. That's your aspirin, and basically any pain med besides Tylenol or an opioid. It interacts with, causes an increased risk of bleeding, so if you fall, you bruise easier. So overall, just a good one to avoid because it doesn't help you at all really with your disease state and increases your risks. Vitamin B12. I heard a lot of people in here are taking this one. Why do you take it? Let me just ask.
I was low on B12, so the doctor told me to take it.
Okay, so this is one that they actually do test your levels for in the blood. But even if you aren't tested, you can still take it. It is a water-soluble vitamin. What water-soluble means is that as long as your kidneys are good and you don't have any kidney problems, you can't overdose yourself on it because your body will eliminate it through the urine. So if it makes you feel better, take it. It's kind of my philosophy on it. It comes in sublingual forms. It comes as tablets. You really can't orally overdose yourself with it. Now, if you look in the literature, it says no evidence of disease state. Who cares? If you feel good on it, it's cheap, it's available, you can't hurt yourself on it. If you want to take it, go for it. Nobody's going to have any problems with that. Unless, of course, you're on hemodialysis, little caveat, but overall, the average person, no problem, and if you feel good, why not? Fish oil. That's another one of these areas that we see a lot of. Everyone's got the new miracle krill oil, red something, we watch TV, we see it. So they proposed that it would help with some of the inflammation causing MS. We're going to jump down here and say that it really didn't show any promise for helping MS symptoms. However, it's not a bad medication to take if you have MS for your heart. You just want to talk to your doctor about it. It does affect your cholesterol panel. The fish oil you buy over the counter causes your bad cholesterol to go up. Now, some people, that's a major problem. If you have high cholesterol to begin with, it's a problem. If we are high and then we put something on to make it worse. However, if you're fine and your doctor says it's okay, you can take fish oil because it helps with earwax production. Omegas have been shown to be good for the cardiovascular system. So there's a lot of benefit from it. But when we look at fish oils, it's kind of like the coenzyme Q10. We have to look at the quality of the product we're buying. And what I say is turn that bottle around from the fancy label to the back and see if they quantify the EPA and the DHA in there. If they've actually put a milligram dosage on the back, to me that's a good sign that they put a quality product in there because there's good fish oil, there's bad fish oil out there. And they've taken the time to send it to a laboratory to tell you how much is in there. So you automatically know that they put a little bit more pride in their product and you're going to get a better product. Another thing to look at too is that kind of just look overall and see how much is in there. Look at the capsules if you can. Some of them are kind of cloudy and just junky and they smell really, really fishy. Others don't smell as fishy. Kind of how much they smell fishy is often how pure it is. So if it smells really, really bad fishy, it usually means they just put the oil in there and they didn't purify it at all. So you get some more junk type stuff in it. A lot of people report burping with this medication too. Freeze them. Stick them in your freezer. That tends to cut down on the burping. Also take it at bedtime, so if you do have the burping, hopefully you sleep through it and nobody knows. But the freezing is a major thing that does help. It just kind of releases slower in the body and helps cut down on a lot of that. And if you take the recommended dose and you can't tolerate it, go down and work your way up too. A lot of people take all three, really upsets their stomach. Drop down, take one for a couple weeks, take two, work your way up too. Your body will adapt. Zinc, I think about 5 years ago, everyone saw Zicam and zinc's going to cure you from the common cold. It is the big miracle drug of life. Well, first off, it does cause changes in the immune system, kind of revs it up a little bit. That's been pretty proven. So we want to avoid excess zinc supplementation within people with MS because we don't want to cause that immune system to get any more revved up than it needs to. Now in your multivitamin, you're going to see it has zinc in it. That's fine. That's just normal, just the normal amount you need for daily life. I'm talking above and beyond, like taking a zinc supplement. Another problem with zinc that we often forget about is that if you take a lot of it, it changes your taste buds. Kind of puts a constant bad taste in your mouth. And if you take away the zinc, it tends to come back. Your taste buds tend to come back. So a little bit of problem with that too. So I'm not a big fan of getting a lot of extra zinc in our diet. To me, it's just the risk, especially in MS, is there. The possibility of anyone getting a bad kind of nasty taste in their mouth. And so it's just like, take it in your multivitamin, that's fine, but let's not do any excess supplementation. Vitamin D. Now this is a hot topic item for about the past 5 years, and it's still relevant. So vitamin D helps with our bone health. We also think it helps with immune system function, heart health. We're finding it's important to the body. Most doctors check your level anymore, and the normal level comes to be 30 to 100. 30, as you can see, that's a pretty wide range. Now I'm sure many of you in here has had to do that vitamin D supplement like once a week for 12 weeks because you were low to get you back up. That's great. But the reason we get low is, first off, we live a little bit far north, so we don't get as much sunshine, and that is the sunshine vitamin. The sun is needed to help us make it. Another problem is we all stay inside and we wear sunscreen. So my general rule of thumb is that in any month that does not end in an R, you want to take 2,000 international units. If it ends in an R, you want to bump it up to 5,000. Now, some people will tell you that, you can get toxic on it. Well, your doctors are checking the levels. So if it comes back super high, they're going to find that, and you can just cut out the supplement. Most people, though, when they do that, they're barely going to get over that 30 anyway. So the reason I say that, though, is if you look at the calendar, your fall, winter, and early spring months all end in R. That's when we get less direct sun. That's when we have less time out there that our bodies can make it. So let's put more we ingest more. In the summertime, we're outside, even if it's just sitting outside enjoying a beautiful day. We get more sun exposure, so we don't need as much because our body's making some. So I personally am the believer, everyone's deficient. Let's all take it. Kind of like almost put it in the water. So, any questions on this? I want to pause here because a lot of people have questions about vitamin D out there.
Do you recommend whole food vitamins?
I think it's just quality.
Okay.
Just look at the quality. Coenzyme Q10 in your fish oils, I definitely believe in a little bit higher quality. Melatonin, vitamin D, I'm not as picky about. There's just less stuff there that we're worried about getting in there. Okay, so now we're going to move on to just some alternative therapies you may have heard about in the world. Bee venom. It's being looked at a lot of different disease states. I don't know why people get on this, but they seem to. The thought process is that it would kind of maybe help with some of the fatigue, somehow help with the immune system, stopping it from being as bad. Long and short, it doesn't help, and who wants to be stung by bees on a regular basis? It's just not a pleasant, and even if we could purify it and we put it into an injection, who wants to be putting poison in their body? Venom is a fancy term for poison. So it's not been shown to help. It's been shown to cause a lot of people to have that anaphylaxis where they stop breathing, so let's just avoid it. But you might hear about it because it's kind of like that new natural miracle everything, kind of like cannabis. Now, reflexology. Now, this is one that kind of falls under one of those categories of, if you look at the evidence, they say it doesn't help, but if you ask the patients, they feel better. So, there's not any harm. They're just pushing on pressure points, and a lot of people say they feel better. So I say, if you feel better and it causes no harm, if you want to do it, do it. That's kind of like acupuncture. It really doesn't hurt you, and if you feel better, that's what it's all about. It's all about quality of life. We all want to feel good. We all want to be able to do what we want. And if reflexology makes your feet feel better, tingle less, burn less, and you can afford it, do it. Why not? Let's get feeling better. Another one is like the magnets. You've seen the wrist magnets, baseball players. That's another one. They say we have our magnetic fields, and if you interact, you feel better. There's no evidence to say that. But what's the harm in putting a little magnet on your wrist? And if it makes you feel better, that's okay. I'm not going to say that, if you can't afford it, save up to do it or anything like that. But if you want to try it and you find it works, sure. It's not an excuse not to take your medicine, but if it makes you feel better, add it on. So, we're going to end with just a couple of tips and take-home messages. Remember to keep your doctor up to date, all your doctors. We all have our neurologist, we have our general practitioner, we have our cardiologist, and one may be here, one may be down at BJC Barnes, and another one may be an independent. Those computers don't all talk to each other, so make sure you keep a list of your meds or bring them to your appointments. And when I say meds, we mean your prescriptions, any over-the-counters you're taking. So if you take a Tylenol, remember to put that on there because those do anything interacts, and any supplements. That means your multivitamins, anything we covered here, anything that you decided to take at the health food store, all that qualify because they do interact and all the doctors need to know what's going on. And we all like to think doctors talk to each other, but we all get busy and sometimes things get missed. So if you have an updated list, it helps prevent that. Another thing that isn't on here, but I like to add is use one pharmacy for everything if you can. Because a lot of times the pharmacy is the only place that has a central database of all your medications to catch those interactions. As pharmacists, we understand them. A lot of times we understand them better than the doctors do. So we can help you troubleshoot anything. We can make recommendations upon, will it interact? If it does interact, what do you expect as far as side effects? And we can even help reach out to your doctor sometime if there's a problem there. And we're usually readily available. We pick up the phones. Like it says right here, all your doctors, all your visits, bring all your medication list. Can't stress that enough. And last but not least, take your medicines as your doctor tells you and never stop unless they tell you to for some reason. If you're having an emergency and you feel like it's something, reach out to your pharmacist then too. We can help you figure out how to either aid, manage, or figure out the best course of action. So the key is make sure everyone knows what's going into your body so that way we can all manage it accordingly. Yes, ma'am.
Can I ask you about magnesium?
Okay.
Take extra magnesium?
So magnesium, that's a good one we brought up. So magnesium is what I call a relaxer in the body. It tends to relax everything. Magnesium is also found in milk of magnesia, which we find in those Phillips bottles that everyone's mom used to give you when you were constipated. Well, magnesium is fine, but if you take too much of it, you are going to get loose stools and or diarrhea. So you can take it, but beware. But there isn't any harm in it. It's kind of like calcium. It's really hard to get too much magnesium into your body because most people get diarrhea and stop taking it before you can take too much to cause any harm. But a lot of people do report it helps them relax, especially before bedtime or any muscle stiffness you may have. Good question.
So COQ10 helps with the contraction of the heart, how the muscle kind of functions. Is that correct?
Yeah, so it's overall important for muscle function. Muscles have lots of different moving parts, lots of proteins involved, and that is just one of the things that we find when we looked at the studies, helps those muscles keep working properly. And that's why whenever we take the statins and it goes low, we feel the pain of our muscles kind of breaking down and not working properly. Yes, sir?
Will that then help with the pain? I mean,
Yes.
from statin?
Yes, definitely. And that's why I always say look at the quality, because coenzyme CoQ10 is real hard to get into the body. So it has to move from our GI tract into our blood. And it's hard for the body to absorb it. So a lot of times the higher quality products try to put it in such a form that you actually get it in there. Because we got to first off get it into your blood, and then once we get it in there, we have to get enough of it to be useful. So that's why I usually say the higher doses and the higher quality, because they tend to help dissolve better in the water in our stomachs and get into your body.
Also with your, we were going back to cannabis.
Yeah.
So they only proved in the studies that it only worked well for spasticity, correct?
That was the only reported improvement that patients saw.
Okay.
So, but beyond that, though, it does help with other things such as nausea. I know a lot of people take a lot of pills are taken, and some of those cause nausea. And when you get nauseous, sometimes you don't want to eat either. So that's where it kind of, there's a lot of other benefits to it. But as far as if we're going to focus down on MS symptoms, people reported feeling like there was less spasticity. But when we looked at it from the scales, like the medical scales, there was no difference. It's been a long time since I've looked up valerian root. So my rule of thumb is, when in doubt, avoid it, because they tend to have a lot of other stuff in them. If you wanted to look for a natural relaxing, I would go more the magnesium route, because that is something we need, and it tends to be a little safer. You're not going to have when you do teas of roots, you have not only the substance that's going to help you relax, but you're also going to have a lot of other stuff in it. That natural products have lots of different chemicals in it. So yes, there may be something that's safe in it, but there may be 14 harmful things. But magnesium, we know it's magnesium, it's safe. If you want to try that route, there's nothing wrong with that.
Any other questions? Join me in thanking Stephen. That was wonderful information.